Good evening, everyone. Please, can you give me a thumbs up if you can hear me? Can you give me a thumbs up if you can hear me? Or you can let me know in the chat box if you can hear me. Aisha can hear me. Amazing. Thank you so much. Hey, Mariam can hear me. Thank you so much. Anybody else? If you can hear me, can you give me a thumbs up? Jessica can hear me. Thank you very much. Is there anyone else that can hear me and can see me? Sandra can see me. Amazing. And hear me. Thank you so much. So it's 7 o'clock West African time, and it's time for our health talks. Tonight is the second edition of our health talks at World Life Foundation. And as promised, we are here to give you value for your time and to also equip you with knowledge on the topic of PCOS. However, we had quite a number of people sign up for this webinar, and we're hoping that a good number of them show up. So I'd like you to invite your friends. If you know someone who's supposed to be here, you can send the link to them directly. The meeting is free for anyone to enter. You can send this link to them and you can invite them to join us. So we're just going to give another 3 to 4 minutes while we encourage others to join us. I will send another reminder email. And if you've been getting our emails nonstop, I am the person behind that, bugging you with the emails, but just so that you do not miss out on tonight. So once again, you are very welcome. We will begin shortly, and stay put for tonight's session. Like I said, invite someone you think should be here. Invite them to join us. Thank you. All right, welcome back once again. If you signed up using your email address, you should have received another email from us now. I'd like to just do a little survey. We have been trying to find the best way to keep in touch with people who sign up for our webinars like you. And we tried a few different strategies leading up to this webinar. We used emails, we used bulk SMS, and we also used WhatsApp as well. So I'd like to know which of the channels you were able to get information about this webinar. Was it through our emails or through our bulk SMS or through WhatsApp? I'd like to see your responses in the comments. This will help us to prepare better for our next webinar. So if you don't mind, let me know or let us know in the chat box. How did you get information about this webinar? That is, how did you get the link? Was it through our emails, through our bulk SMS, or through WhatsApp? Your responses will help us a great deal as we prepare for our next webinars. Joy says she got the information via email. Amazing. So that means you were getting our emails. Thank you so much. Is there any other person that would like to tell us how they were getting our information? Was it helpful? Do you prefer email, bulk SMS, or WhatsApp? Sadia said she got it via email. Thank you very much for your response. Is there any other person that would like to tell us how they got information about the webinar? Jessica says she got it via email. Thank you very much. Thank you so much. Thank you so much. If you'd like to tell us how you got the information, it would be amazing because it will help us prepare better next time. So for those just joining us, you're very welcome. We are set to begin our webinar for tonight. We are just giving a few minutes for others to join us. And while we wait, we're just doing a little survey to know how you got information about this webinar after you signed up. Was it via email? Did you get WhatsApp message from us? Did you get an email or a bulk SMS from us so that we know how to prepare better next time? All right, Stacy said she got it via email and bulk SMS. All right, Jessica says she got it via email. Aisha says she got it via WhatsApp. Amazing. So it seems like the email team seems to be winning, and we will continue with our emails, but we want to assure you that we will do our best to keep you abreast with our coming webinars. All right, so I think it is a good time for us to begin. And I'm just going to take the next few moments to introduce myself, talk a little about what we do at World Life Foundation, and immediately hand over to our executive director who is handling tonight's webinar. Good evening, everyone. My name is Christine Vihishima. I am the programs officer at World Life Foundation. And World Life Foundation is a medical health care organization that is so passionate about reaching the underserved with medical, help in different forms. And we are really, really passionate about this because as Nigerians, which I believe make up the most of the population in the room, we understand how delicate, I think I'll use that word to be politically correct, how delicate our medical system is in Nigeria. And that is where World Life Foundation steps in. We believe that everyone deserves access to quality healthcare. And we are trying to play our role as community builders to contribute to helping as many people as possible with quality healthcare. I'm privileged to be working at World Life, and being part of the team has been amazing. And one of the ways through which we're able to bridge this gap is through health education. We believe that health education is one big way or one big preventive measure for many of the medical issues that we have around us. When we're growing up, our parents used to tell us prevention is better than cure. And we believe that through health education, we are preventing a whole lot of things from happening. And that is why you're here tonight. We started a health series called World Life Health Talks. And what we aim to do in our webinar series is to engage in health education on pertinent issues that surround our health and well-being. And we are going to be talking about navigating PCOS and other health-related challenges. And we are going to be having this session taken by our executive director, Dr. Ibrahim Yakub Simen. And I am privileged to be inviting him to the stage. Please let's give him a round of applause. If you can find the clapping emoji, please let's welcome him to the stage. Sir, the floor is yours. And also I would like to say that for anyone who is listening, if you have a question, you can drop it in the chat box while he's teaching. I will take note of it, and during the question and answer time, I will ensure that he's asked the question. And if you want to ask the question yourself, you will just indicate at the end of our class, and you can go ahead and ask your questions. Invite someone who you think is supposed to be here. Share this link with them. Share the link on your WhatsApp status. Tell someone that something amazing is happening here and they should not miss out on it. All right, sir. Over to you.
Thank you, Christine. I don't know if you can hear me. Can everyone
I can hear you, but I can't see you, sir.
Okay.
I can't see you, sir. I think your camera is off.
Can you see me?
Yes, perfectly. Can see you, sir.
Okay. Thank you. My screen. Can you see my screen, please?
Yes, I can see your screen. Can everyone see Dr. Yakub's screen? Please give us a thumbs up if you can see it so that we know. Okay, everyone. Okay, awesome. Awesome. Yes, I can. All right, sir. I think we are good to go, sir.
Great. Thank you, Christine, once again for the opportunity. We at World Life Foundation, as she said, we believe that health education is one very important way we can prevent diseases, because when people get to know certain things about certain diseases, perhaps that information will help them in knowing how to avoid contracting such diseases. And for those who already contracted diseases, at least having information concerning those diseases will help them navigate through such issues. So it is in this regard that we believe that this being our second edition in our Health Talk series, we believe if we talk about PCOS, which is actually a very common medical condition, in this case, particularly affecting the women. Of course, generally, we're also going to take on topics that concern every aspect of human life as much as we can. So we should bear with us. We're not only going to be limited to things related to women, we're going to be talking about other things as well as time goes on. But today, as she has introduced, we are going to be talking about PCOS. In this case, we want to see what PCOS is all about. How do we navigate through it? So if everyone is seeing my slide, I'm going to move on to the outline. Well, we'll briefly talk about the background. We'll define what PCOS means for everyone to understand in the language we believe everyone can understand. And then we'll talk about what are the things that people who have PCOS, what are the things they go through, what are the things they experience, and then how do we make a diagnosis of PCOS. And then, of course, we talk about other health challenges that are associated with PCOS, and then we'll talk about how we manage PCOS and then conclude. So basically, as a way of background, PCOS, full meaning of that means Polycystic Ovarian Syndrome. It's a disease that affects women in their reproductive age. Reproductive age meaning childbearing age, and that is considered as age between 15 and 49 years. So it is in this group that any woman who will suffer PCOS will be. Usually before then, that is less than 15 years. And after that, generally, we don't have PCOS because it is it is directly related to the activities of the ovaries. So it affects 10 in one woman in this age group. I mean, 1 in 10, rather, sorry. 1 in 10 women in this age group. And then to give us a perspective of how serious it is, women in this age group, that's in reproductive age group, all over the world, is they're about 1.9 billion. And of these 1.9 billion women, 4 to 12% of them are affected by PCOS. That's a huge number because that translates to about 76 to 228 million people, women in this age group, having this condition or living with this condition. And that is quite huge. So it's actually a very public health issue as well. And it appears to be growing. That is, the prevalence of PCOS seems to be growing for things that we're going to see much later on. The cause of PCOS is largely unknown. That is, there is no known direct cause of PCOS. However, it appears to run in families. In other words, there seems to be some kind of genetic predisposition to polycystic ovarian syndrome. And obviously, there seem to also be some environmental factors that contribute to causation of polycystic ovary syndrome. We're going to see some of these factors as we go along. So there are some, for those who, though we say we don't know what exactly causes PCOS, but there are certain things that are very clear for amongst people who have PCOS. There are certain chemical or biochemical or hormonal stains or changes that are peculiar or that are found in people living with PCOS, which are different from those who don't have PCOS. I will just run through them. I'm going to, for those of us who are not medically or scientifically inclined, I'll just mention them. But as we go along, you're going to see, I'm going to try to explain some of these terms. So there are three things essentially that are associated with PCOS. We have abnormal LH-FSH secretion. I will explain that much later. Abnormal androgen or estrogen secretions. As I said, I will explain all of this. Then insulin resistance. These are the three basic issues that people who have PCOS deal with. And as I said, though we don't know what caused these things, but these are the main issues these are the main changes that occur in people who are living with PCOS. And it appears as if most people, a lady that will eventually develop PCOS, some of these biochemical or hormonal changes begin to occur even before she gets to puberty. That is, puberty is the age when a young lady uh, attains what we call secondary sexual characteristics. That is like things like armpit hair, private area hair, breast development, and all of those things before she eventually starts menstruating. So those are pubertal events. So before the lady who will develop PCOS gets to those areas, it appears as if some of these hormones begin to actually show, which means that ladies who will develop PCOS begin the journey much, much early in life. Of course, when it now manifests, eventually depends on the severity of the hormonal changes or biochemical changes that occur before the time they begin to manifest it. So polycystic ovary syndrome is a set of, by definition, basically it's actually a set of conditions or symptoms that we say in a woman of childbearing age related to hormonal imbalance. Now, this hormone imbalance, as we go, in this case, I'll just try to explain what it means. For those who don't have hormone imbalance in women, there's usually some pattern of hormonal status or hormone status that is expected in ladies who usually menstruate during their menstrual cycles. Now, for those who have PCOS, however, we see that there seems to be imbalance in favor. Now, there are two types of hormones in this case, the masculine hormone as well as the feminine hormone. The masculine hormone are called androgens. The typical example we have is testosterone. Then the feminine hormones are the ones we call estrogens. Now, generally in people who have PCOS, usually the balance is tilted towards a little bit more of the masculine hormone in them. And that is actually what is primarily responsible for the symptoms they go through. So that is the hormone imbalance we're talking about. That is a little excess of the male hormones compared to the feminine hormone, as it were. So women with PCOS usually have at least two of these three things. It's important we go through this because in practice, we see a lot of women coming in with diagnosis of PCOS or no diagnosis of PCOS when it should have been diagnosed, or diagnosis when it should not have been diagnosed, because the places or whoever made the diagnosis did not really understand the PCOS itself. And that is why I want every one of us to understand there is a criteria, or there is a set of things that have been set aside as criteria before we can make a diagnosis of PCOS in any woman. And there are three things in this case that are essential. The first is a lady who is going through PCOS disease should have some absence of menstrual, irregular menstrual periods. Usually the menses do not come regularly, as it were. Now, in this case, when we say they don't come regularly, it means that the woman cannot time her period to the date that she expects them. Almost always, it doesn't have a pattern per se. So, however, I want to say here that the fact that the date changes in a calendar month does not mean your menses are not regular. Okay, when we mean irregularity, we mean in the exact number of days it occurs. For instance, the average number of days that women see their periods monthly is 28 every 28 days. Okay, for those who see their periods every 28 days. But there are people who don't see it every 28 days, they see it every 21 days. So, but we say that normal menstrual cycles may span between every 28 days up until every 35 days. As long as your periods are coming in this number of days and that is your regular pattern, then it is considered as normal. But once in a while, there may be some changes in the days by 1 or 2 days. That is not considered as irregular period. For those who have PCOS, I will show later the number of days that we consider as irregular periods. Then, of course, I mentioned the high level of masculine hormones in them. And then, specifically, there is this thing in their ovaries that is considered a criteria before we can make a diagnosis of PCOS. That is what we call polycystic ovaries themselves. But we'll come to that as we go along. So these features we talked about, that is, what are the things that women who go through PCOS experience? I mentioned irregular or absent menstrual cycles. Here, as I was saying, usually women who have PCOS have cycles typically greater than 35 days. That means if she sees her period today, before she sees the next one, it might take more than 35 days, usually. And sometimes it could take months, and sometimes they don't even see the period at all for several months. And usually people who suffer PCOS, especially where it is well established, they see less than 6 menstrual cycles per year. And the central reason why this is so is because they do not ovulate regularly. And so once ovulation does not come, then of course they will not be seeing their periods. That's very, very central. That's very key. One of the major criteria to know whether a woman has PCOS. In the beginning of PCOS, however, some women do not have these menstrual irregularities, and for them, of course, it will be difficult to make a diagnosis because this condition, the absence or irregular period, is one of the cardinal conditions that is required to make diagnosis of PCOS. Now, for them, because of prolonged days they spend without a period, when the period eventually comes, they bleed very, very heavily. And that's one of the things people or ladies living with PCOS suffer. The other feature we see is the features related to excess masculine hormones, which is called hyperandrogenism. Basically, the ladies suffer a lot of physical features, particularly skin and muscle features that would suggest that yes, this lady has PCOS. In this case, we have 2 or 3 features that are common with PCOS related to hyperandrogenism or related to excess masculine hormones in them. One is hirsutism. Hirsutism is the growth of terminal hair in areas that normally it's males that we see in. For instance, you see women with facial hair, upper lip, the chest area, and sometimes little below the navel. Women typically should not have hair in these places, but these hairs are typical of PCOS because they manifest as a result of excess masculine hormone, which we call the testosterone. Then the other thing they suffer a lot is acne, and this acne sometimes does not respond to the non-hormonal acne treatment. There are a lot of women who we see who visit skin doctors with severe acne, and then the skin doctors, the dermatologists treat them and sometimes refer them when they suspect that, especially where the the acne is not responding to conventional treatment, where they suspect PCOS, they usually end up referring them to the gynecologist to be co-managed together. Now, virilization is where you have excessive manifestation of masculinity in the woman. In this case, we might see her voice deepening, like in the case of males. And then sometimes you even see some women with increased muscle mass and features, chest features that look almost like males. So these 3 things, hirsutism, that is excessive hair growth, especially in male pattern distribution, acne, and virilization, are things that are seen because of excessive male hormone. These ladies are, and the lady in the left of my screen, you can see a lot of acne and on her face. And then the lady on the right of my screen, you can see a lot of hairs. She has upper lip hair. That's what we call popularly mustache. She has hair inside in her chin, and of course all over the body. These are features that we're trying to describe as a result of the excessive male hormones in them. Now, when we meet ladies with PCOS, I want us to understand that you must have, as a lady, you must have at least 2 out of these 3 things we're going to mention to be able to, for anybody to label you PCOS. Without this, it is not accepted as PCOS. So for you to have a diagnosis, or for a lady to be diagnosed as having PCOS, she must have at least 2 out of these 3 conditions. One, I mentioned amenorrhea or oligomenorrhea. What this means is absence of periods at all. That means she's not seeing her menstrual periods for several months, or she's seeing few menstrual cycles in a year. As I mentioned earlier, less than 6 cycles in a year. 2, there must be features of excess masculine hormones. In this case, as I mentioned, the body hairs and the rest of them. 3, there should be what we call polycystic ovaries on ultrasound scan. This is more technical. Someone must be able to scan, and the scan should show polycystic ovaries in the ovaries. Now, this is for just for all of us to appreciate what we're talking about. On the left of my screen, this is a scan report showing an ovary. You see, I don't know if you can see my cursor. In this ovary, we have few dark areas. These dark areas are called uh, follicles. These are called follicles. Now, normally in an ovary, a normal ovary, we have less than five, six, usually at the beginning of the menstrual cycle or anytime during the menstrual cycle. But on the right of my screen, you can see plenty of them, a lot of them here arranged around the periphery of the ovary. This is classical polycystic ovary. So this is a condition that must be met for or before diagnosis of polycystic ovaries is made. So in summary, we have three things as I mentioned before. Uh, this the lack of period or irregular period, and then features of excess male hormones, and then the appearance of polycystic ovaries before we can say that a woman has or lady has polycystic ovaries. Without two out of these three at least, then polycystic ovary diagnosis cannot be made, because the reason is this: there are so many other medical conditions that can actually come with lack of periods. There are other medical conditions that can come with male hormones, excess male hormones in the woman. There are other medical conditions that can come with polycystic ovaries in the woman without the others. And in that case, we cannot isolate any one of these situations and label a woman or a lady as having polycystic ovary syndrome. So, what are the other health related challenges? Well, polycystic ovary syndrome, because I mentioned something, because of the hormonal imbalance that they experience or that is in them, this hormone imbalance, particularly in this case related to insulin. Insulin is one hormone that it's popular among or known among people who are living with diabetes. It is a hormone that when it is lapsed, when it is lacking in an individual, or it is not enough, usually the person develops diabetes. Now, for people with polycystic ovaries, they actually have a lot of the insulin because they have something we call insulin resistance. Now, this group of people, because of the insulin resistance in polycystic ovarian in women living with polycystic ovaries, they usually have increased risk of developing diabetes. And there are the type of diabetes they commonly develop later in life is called type 2 diabetes. The type 2 diabetes is a diabetes where you may have insulin, but your insulin is not enough. So you tend to have a lot of sugar circulating in your blood. This is one very important thing, information we need to have for those of us, for those ladies living with PCOS. It is important to note that they have increased risk of diabetes. At some point, we're going to see how to avoid some of these things ultimately. There's another type of diabetes they are prone to, which is called pregnancy-associated diabetes, or we call it gestational diabetes, again, because of the insulin. So they tend to have these things more as compared to women who do not have polycystic ovary syndrome. Subfertility. Subfertility, if you look at the word, it's called subfertility. They tend to have difficulties in conception. That is because, as we mentioned earlier, they usually have these ovulation problems. They don't ovulate regularly, and so because of that, they tend to have difficulties in conceiving. So it's important that ladies who have PCOS or who have been diagnosed with PCOS should know that, yes, this uh, risk is higher in them. It's not as if a woman who has PCOS will never have a child. No, they could have children. However, it may be relatively more difficult than women, I mean, for them to get pregnant. And sometimes they even have higher risks of miscarriages, in this case related to excess male hormone in them, which tends to interfere with quality of their eggs and ultimately quality of the embryo, that is the babies they form, and they may have increased risk of miscarriages because of polycystic ovarian syndrome, I mean rather because of the male hormone. So it's important that ladies who have polycystic ovary syndrome understand that they have this risk, so that when you think about fertility, when you think about childbearing as a lady living with polycystic ovary syndrome, it's perhaps very important that you start the journey earlier than others. Obesity affects about 40% of ladies with polycystic ovary syndrome. There are those who don't have obesity, we call them the lean PCOS patient ladies, but up to 40% of them have obesity. And those who have obesity have this situation, of course, during sleep, they tend to have this choking feeling. They tend to choke while they sleep, and it is called obstructive sleep apnea. It's a very distressing situation for those who go through to experience it, because it's scary. If you live with someone who has obstructive sleep apnea, sometimes it's so bad that a machine has to be attached to them to help them breathe through the night smoothly. Okay, we call it CPAP machine, but of course that depends on the severity of the problem. Then we also have increased risk of heart attacks and strokes in people who have polycystic ovaries. So those who have polycystic ovaries have increased risk of heart attack, because they also seem to have some things we call abnormal lipids, all those cholesterol things we hear about. They tend to have all of this. So they also have increased risk of heart attacks and stroke. So the other medical conditions or health-related conditions that people who suffer polycystic ovary syndrome also experience is hyperprolactinemia. Hyperprolactinemia is a condition where the woman or the lady experiences a lot of milky discharge from the breast as a result of uh, high level of breast milk hormone when she is not nursing a baby. Ordinarily, of course, we know that women nursing babies will express their breast milk for the baby. But when you're not nursing a baby and you have milk discharge coming out, and that is not supposed to be. Of course, there are people who don't have polycystic ovary syndrome who have this situation, but commonly polycystic ovary syndrome ladies seem to also have hyperprolactinemia. That is this leading to a lot of breast milk discharge, which sometimes can be socially embarrassing. Now, the prolactinemia or the excessive breast milk hormone seems to or tend to worsen their ovulatory problems, because if you remember, in those days, our mothers used to breastfeed. Well, when there was no family planning measures, women had in those days planned their families or contraceptives by just making sure they breastfeed their babies. And breastfeeding tends to ensure that a woman does not get pregnant as high as or serves as a contraceptive as high as 98% provided she's breastfeeding well. So it serves as a contraceptive. So for those who have polycystic ovary syndrome and have excess breast milk hormone, it tends to worsen infertility in them. Then there is this condition they also have, they're at risk of, which is called endometrial cancer. Endometrial cancer is a cancer of the lining of the womb or the uterus in women. And that is because usually people who have polycystic ovary syndrome, as we said, they have these prolonged periods of lack of menses. So the lining of the womb, which sheds every month, does not shed regularly in them. And because it grows and grows and grows and grows and keeps getting thicker and thicker, over time, there's a risk of it transforming into cancer, which we call endometrial cancer. So these are some of the other health-related challenges that people living with PCOS may face. How do we manage polycystic ovary syndrome? Now, the sad part in this is the polycystic ovary disease or syndrome does not have a specific cure, unfortunately. That is because we don't know exactly what causes it. However, there are treatments that can be instituted depending on what the lady is presenting with or what is her major concern. For instance, sometimes women will present for the first time with acne to the doctor because she probably has had irregular periods. She probably has had maybe little hair growth here and there. She probably is on the heavy side, but those things probably don't bother her. But once some acne appear on her face, and then she, for cosmetic reason, present to the hospital. And through that, investigating the cause of the acne, the doctors may find out that the woman has polycystic ovary syndrome. But for her at the time, of course, her major concern at that point may be the acne. On the other hand, there are ladies whose presenting complaints might just be that, oh, the periods are not coming. And so for them, that is how we address the problem as the woman presents. Sometimes we see women coming to the clinics to complain about difficulties in losing weight. They can't just lose weight and they don't know why. They tried all kinds of things and they cannot lose weight. So basically, the way PCOS patients are managed depends on what is their presenting complaint. And I will go through, there are general measures that are considered helpful for everyone who has polycystic ovary syndrome. Weight loss, of course, especially for those who are obese PCOS patients, when they lose weight, they seem to there seem to be some improvement in the symptoms generally in everything, including the hairs, including the abnormal periods. All of that seems to regularize when they lose significant weight. Regular exercises, of course, will help. Then diet, I will emphasize on the diet a little more in my next few slides. Diet is very important, but generally we say they should reduce carbs and increase fruits and vegetables to improve PCOS symptoms. Now, these are the foods that any woman living with polycystic ovary syndrome should try as much as possible to avoid. Unfortunately, if you look at the list, they look like those things that we all love to eat. Fried foods, the list is endless, but I just put a few examples here: potato chips, chicken, fried chicken, and the rest of them. As long as they're fried, in the frying, there is this thing we call trans fats that tend to worsen symptoms related to polycystic ovary syndrome. So if you have PCOS, it is actually very helpful for you to avoid fried foods as much as possible. Saturated fats, of course, saturated fats are any fat or any oils that tend to solidify in room temperature. It's called a saturated fat, like butter, margarine, and the rest of them. These are things that may worsen polycystic ovary syndrome. Then processed snacks. Again, these are in these times, these are things that people tend to get very comfortable taking snacks, cakes, cookies, candies, and pies. These are things that have been shown to worsen PCOS symptoms. So for those of us who have PCOS, it might be important that we try as much as possible to avoid these things. Then refined flour. Unfortunately, there's hardly anything around us now that is practically everything we find in fast food places or is made from refined flour. White bread, rolls, pizzas, the pastas, everything in that group. It's actually not encouraged for people who are living with polycystic ovary syndrome. Sugary beverages, soda, energy drinks, all of these things tend to worsen PCOS symptoms: red meat, hamburgers, beef, white rice for ladies. I usually make a joke. Once you remove rice from the diet of a woman or for a lady, then you will keep her fasting for days. So, but white rice seems to have something we call, it has high glycemic index, and it tends to worsen PCOS symptoms. Now, foods to eat. If we have PCOS, we have whole grains, corn, millet, sorghum. Of course, generally what we tell people is that the African diet in Nigeria in particular, we have our normal foods that we take. In the southwest, we have amala. In the southeast, we have gari, apple. We have in the north, we have tuwo in various forms. Those are things that we eat and may not worsen our PCOS symptoms. Leafy vegetables are all over the place. Then complex natural carbohydrates, yam, gari, and malado, as I mentioned them, these are things that do not worsen as compared to the refined things I mentioned earlier. Beans and other protein-rich legumes. Olive oil, of course, it's expensive, but it's better than most of these other oils that we use in frying things. Fish, provided the fish is not fried, because there are fish oils that are very good for PCOS patients. So if you eat fish, but boiled, grilled, or roasted, not fried, drink a lot of water, take whole fruits, and I'm sure you will. These are just this slide just shows some of those things we talked about. Perhaps this is the white man's version of what we just described. Specific treatments will be this one are more medical. When you present to the hospital, usually, as I said, the symptoms, if you present with irregular periods, the doctors may give you what we call oral contraceptive pills for 3 to 6 month cycles and all of that. Usually that will correct it. Or because your periods are not coming, sometimes we are giving oral progesterone, some tablets that will just make you shed the lining of the womb. In other words, you menstruate, and then monthly you can take this to menstruate regularly. Acne, well, if you have acne, usually, or hirsutism, that is excessive hair, usually you have to meet the dermatologist, that's the skin doctor, in conjunction with the gynecologist. They will manage you together. Then infertility, there are specific ways infertility or subfertility is measured, is managed. Ovulation induction, usually you take tablets to make you ovulate and perhaps you conceive. But if that fails, sometimes there are other things that can be done. Laparoscopic ovarian treatment is a surgical way of making the ovaries recover from the stronghold of polycystic ovaries and therefore release them to ovulate regularly. Now, when all of this fail, then of course IVF is just another option. Please, let's note that it is not as if every woman who has polycystic ovaries must go through IVF. No, it depends on the severity and then the situation at the hand. Medications that can help women living with polycystic ovaries: vitamin D. Vitamin D supplementation or supplement tends to help people to regularize. It improves egg quality and corrects menstrual irregularities. Then there's this popular brand chemical called inositol that also helps women with PCOS to sometimes, as far as irregular menstruation is concerned, as well as conception. Then metformin is a tablet that we use in people with diabetes, and it helps people with, especially the obese patients who have polycystic ovaries, to improve their symptoms. So in conclusion, PCOS is a frustrating medical condition, and it's affected a lot of women. Now, the things that are associated conditions such as obesity, acne, excessive facial hair, and body hairs, and subfertility, all of these tend to affect the woman's mental, psychological health. Though, of course, there is no particular cure for PCOS, there are effective measures to manage each of these conditions to improve the quality of life of PCOS patients. So we will, at this point, leave the next few minutes for question and answers, and perhaps conclude thereafter. Thank you for listening. Christine.
Okay. Hello, sir.
Yeah, later.
Thank you very much for this wonderful presentation. Yes, I can see there's so many applauses. Thank you, everyone, for being here. Thank you for your time. Thank you for your rapt attention. So, sir, we have some questions already in the comments. I don't know if I can go ahead to begin
Yes,
to
please.
read them out.
Yeah.
All right, sir. So the first question says, can PCOS affect both ovaries? If yes, what should be the next line of action for such an individual?
Okay. Okay. Should I
Then, do you want me
answer?
to read all the questions or will you take it
Yes.
one by one?
I think we should read all the questions and then I will briefly answer all.
All right, sir. Then the second question says, okay, so this is an example. Two friends, one has a 27-day cycle, and the other one has a 29 days cycle. Are they prone to having PCOS? They are on this call, so they would like to get answers.
Okay.
Then the third question says, does environment affect menstrual cycle? And then, did you get that, sir?
Yes, I do.
The next question now says, I have a friend who started having irregular periods at her teenage years, and she said that right now she hardly sees her menstruation. So she said she had to see the gynecologist last year, did a lot of scans and tests, but the doctor ended up giving her birth control pills to regulate it. She was taking it but had to stop because she was adding weight uncontrollably. In this situation, what should she do? That's the next question. Then we have one more. Can I go ahead, sir?
Yes, please. Yeah.
Okay. Does PCOS cause immense pain on one side of the abdomen? I have it on the left ovary, and the left side of my abdomen hurts a lot to the point of not walking at times.
Okay.
Yes, so those are the questions so
Okay.
far. I would like to give one more minute for anybody who has another question. Please drop it in the comments. Our webinar is supposed to end at 8 o'clock sharp. So if you have any questions, please drop it in the comments. As you are here, you can see our address if you need to locate us. This is also where our hospital, the Wildlife Hospital, is also located. If you feel like you need further medical attention, you can visit our hospital, Wildlife Hospital at 12B at Barra Street, Wuse 2, Abuja. You can also visit our website at www.wildlifefoundationg.com. You can email us at wildlifefoundationg@gmail.com. And you can follow us at wildlife_foundation on Instagram. So, sir,
Yes.
are
Okay.
you good to go?
Yes, please.
All right,
So the
go ahead.
first question was, does PCOS affect both ovaries? Yes, it does. In most cases, both ovaries are affected, but once in a while, one ovary may be affected more than the other. And that does not necessarily reduce or change the situation. So, however, it's more likely that a lady who has PCOS in both ovaries will have more symptoms than the lady who has in one ovary for obvious reasons. The hormones produced by both ovaries will probably be more than the hormones produced by one ovary. But by and large, this presentation and the management are the same, whether it is in one ovary or both ovaries. It doesn't change anything at all. So I hope that answers the questions. Then the second question is 27 days cycle and 29 day cycle. So as I said, for each of these ladies, that is their normal. As I said in the presentation, there are women who have cycles every 21 days. There are women who have cycles every 24. So between 21 to 35 day cycles, as long as it comes in that pattern, that is your normal. And another lady may have a 29-day cycle, that is her normal. So no two ladies would have exactly the same number of days in their cycles anyway. So it is normal for everybody to have her cycles in this range of days. So it is normal. There is no problem with them. So then does the environment affect the menstrual cycle? Yes, of course it does. Sometimes in women may have noticed some women experience cessation of their periods when they change environment. It may be temporary to the extent that maybe you miss few 1 or 2 menstrual cycles before because you've changed the environment from one city or from one area in the city to the other. The reason why that comes up is because sometimes change in environment is associated with new stress or environmental factors that you are exposed to that may change your menstrual pattern. And so that happens once in a while in every woman. So yes, it does affect sometimes the menstrual cycle. Yes, change in environment or environment can affect menstrual cycle. The other way environment can affect menstrual cycle is exposure to substances in the environment that tend to also interfere with your menstrual hormones. We call them endocrine disruption chemicals. This also can affect you depending on what they are. You know? Teenage periods possibly, yeah. Okay. The fourth question talks about someone who has irregular periods during her teenage years, and then eventually the periods didn't come, and she visited the gynecologist. Well, most likely, the reason the gynecologist uh, prescribed the oral contraceptive pills is because he either suspects strongly she has PCOS, or he feels sometimes, I don't know specifically what age she is at now, but in teenagers, sometimes there is this thing that we say happens in them. When they start their period, for the first 2 years or thereabout, the periods are never regular, and then sometimes they just disappear. So because of lack of immaturity of the system that regulates these hormonal cycles, so they sometimes doctors can prescribe pills to try to regulate them. But in her case, I think it is important, since the oral contraceptive pills are making her gain more weight, it is important that she is properly evaluated by someone who is more thorough, more detailed, so that if it is PCOS she's dealing with, other measures may be taken to address her situation. Okay. Then does PCOS cause pain? Not usually. PCOS does not cause pain usually. However, PCOS can coexist with other conditions in women that may cause them pelvic pains. That is something like endometriosis. If you consistently and persistently have pain in one area of your pelvis, then maybe you should actually avail yourself of someone who will do a detailed scan and detailed evaluation to know what is causing your pain. But it's very, very unlikely that it is PCOS. So I guess I've been able to address the questions. I don't know if we have a few minutes more to leave. Thank you.
Thank you very much, sir. Thank you so much. All right. So, Aishat, your hand has been up. Do you want to ask a question? If you want to, then unmute your mic and go ahead, please. Aishat? Jessica, your hand is up. Do you want to ask a question? If you want to, please unmute your mic and go ahead. Okay, it seems like we're good and we have no more questions. It's 7:59 p.m. West African time, and I'm pleased to let you know that our webinar has come to a close tonight. So I would like to thank you so much for sharing with us your time, your expertise tonight on the topic of PCOS. I want to believe that everyone in attendance had an exciting and a wonderful time. I'm pleased to let everyone know that this session was recorded and will be uploaded on our YouTube channel in the coming weeks. Of course, I will be in your inbox reminding you to subscribe to our channel and get ready for what is coming. We have exciting more things that are coming. We have a podcast that is coming and so many other exciting, wonderful things coming for you and for the ones that you love. In the next 2 months, we have a webinar coming up, and I would like to invite you, your family, your friends, your colleagues to join us for our next webinar. So get ready, as we will be expecting you. Dr. Yakub, thank you so much for your time tonight. And everyone, have a wonderful night and see you at our next webinar. All right, so Jessica is suggesting we should also talk about fibroids. So we'll take this into consideration as we plan for our next webinar. Thank you so much for that suggestion. Thank you. All right. Good night, everyone, and see you on our next webinar. Thank you.